Okay, so let's try this question. So this is case number 1. So I have a scenario written up, and then I have 2 questions following that. Okay, so the case 1 is Janice is a 46 years of age, is new to your general practice. She has 4 children, the youngest of which is 10 years of age. Following her last delivery, her husband had a vasectomy. She tells you she's very tired all the time, and her periods are a nightmare. They have become exceedingly heavy over the last year or so, and she has to take time off for a day or 2 each month from her work. So overall, you probably have already something in mind, right, just by reading the scenario. So now we go to the question. How can you tell whether or not Janice has menorrhagia? What features in the history of a woman presenting with menorrhagia might suggest an underlying pathology? So this is question number 1, and then you have some gap over there where you can enter your answer, and then you can change to the next question. But the answer to that would be that there's flooding, she needs to change frequently, she's tired, and bleeding. The description of the bleeding, what the patient has to say, that it is a nightmare. Okay. Now the investigations, what the most important investigations? Yeah, I know we can go. There might be a huge list of investigations which can be done for this particular patient, but what we are looking at is that we want some basic investigations which we will do at a general practice level. So most of you have answered quite well in this, which I'm going through the chat box. So FBC, iron studies, thyroid function is indicated, and then another important would be a transvaginal ultrasound. And what do we expect on this particular investigations? Because at the end of the day, we have to justify doing the investigations and what we are looking at. The full blood count will show anemia. Taking the history into consideration, I would do an iron study, which may show low ferritin levels. So that again indicates how bad the situation is. Thyroid function test is clinically indicated that she's also putting on weight, or how the periods have been, and is there any other indicator of thyroid dysfunction which may be responsible for the menorrhagia. Transvaginal ultrasound is again very important because that would just tell us what is going on in the pelvis, so around the uterus, ovary, and just if there's any abnormality or pathology which is giving rise to the problem. Okay, no worries. So is everybody sort of getting the hang of KFC? So now we come down to case number 2. So this again there's a lot of information about the case, and then following that there'll be a couple of questions. So case number 2 is regarding Mrs. Smith, who's age 76, is known to have carcinoma of submandibular glands with secondaries in the cervical node and both the lungs. She was initially treated with chemotherapy for 3 years ago and has just completed a course of radiotherapy to the known metastasis, but without obvious reduction in the size of deposit. She lives alone. She's a widow, and her children live interstate. A neighbor rang to inform you that Mrs. Smith appears to be hallucinating, walking around the back garden, shouting at non-existent people. You attend to find Mrs. Smith sitting in the bed and apparently quite lucid. She complains of no symptoms, but on specific questioning, she admits of seeing men climbing through her window and they were sitting on the end of her bed, talking. Mrs. Smith is flushed, but otherwise has no physical signs. Now, the question will be, what are the likely differential diagnoses? List in note form only up to 5 diagnoses. This is a very typical sort of question which they make. The most important thing, what we would like to rule out in this particular case, if this patient is yours, you will look for infection, you would suspect cerebral secondaries, drug and alcohol effect, electrolyte imbalance, subdural hemorrhage, or a stroke. So out of this, I've marked 2 stars over here. So these might be the 2 most important things which your answer should include, and they may carry extra weightage as compared to a subdural hemorrhage, or a drug and alcohol effect. So unfortunately, I cannot disclose, or I would not know which would be the most important answer would be, or which answer would have more weightage as compared to the other one. But that is what the RACGP decides. But these are the two important ones which I would see if that are included or not. Okay. All right. Now coming down to question 2, what are the most important investigations to arrange today? List in note form only, as many investigations as appropriate. So as you can see in the first one, they said list only 5, and in the second one, they said as many investigations as appropriate. So as like people have mentioned it over there, so we want to rule out infection, we want to rule out if there's anything else going on in the brain. So first most would be that probably the patient needs to be in the hospital, and then blood culture, urine culture, full blood count, CRP, urine culture, chest X-ray, CT brain, all these things will follow that. Not necessarily, the hospital admission does not need to come into this particular as an investigation, but if you would like to mention that in the answer, that would not give you a negative marking. Or there might be an answer. What likely investigations would this patient get done after admission?
Sam has also asked what if she'd said brain pathology?
I think that should not be a problem, because that means either she's suspecting a stroke or a secondary. But I think being a little bit specific would give her a better mark, I would say.
Great. And I'm just checking with Margaret, just asked to go back a slide with whether that was for the question or for the answer.
Mm-hmm.
So I've just got the question there again on the slide, and there's some more questions coming in there.
Mm-hmm.
You would not consider blood sugar level?
Yeah, I think I would consider that one as well, because there was no limit to that particular answer as like the question number 1 in this particular case. I just basically wrote some most important bit, but it would not make any harm adding what Sunil has said, that blood sugar level or UTI as specifically. That's fine.
Now, just there's a question there about CT brain urgently.
Yeah. I think that's fair enough investigations for this particular patient. So I think that should be done.
And I'll just ask Rob to elaborate. Rob, did you have anything to add to these approaches or to some of the discussion that's been going on while Sharma has been speaking?
Yeah, no, that all sounds fabulous, Sharma. Just one other thing that we were told when we were from our training provider and from the RACGP, and was reiterated before the exam. Where you put list in notes form only up to 5 diagnoses, they very, very, very strictly said do not put 6. If
yes,
you put
exactly.
6,
I was just about to come into that.
Yeah.
Yeah. So just I'll let you elaborate.
Exactly, and because the 6 would not carry any mark, and sometimes if you add the 6, the most important one as your 6, you may get no marks for that. And in fact, you may lose marks for that.
Yeah, the RACGP actually says that if you put in 6 options, they'll give you 0 for the entire question.
Entire answer, even though you've written all the right.
Yep, even though you've written 5 perfect ones, and the 6th one might even be correct as well, because you put in more than 5, they'll give you 0, which is not a good thing.
Nothing. Yes. And that's why I put this specifically in the second one, that not as many as investigations. You can see the difference of questions. And the other one, probably you can go on the list, whatever, MRI, from urine examination to MRI, you can do anything for this patient.